Welcome to Indian Anatomist. Individuals who want to pursue a career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is General Anatomy 4.4, and the subtopic is Joints and its classification. What is arthrology? It is a combination of two words. Arthro means joints, logy means study, so studying the joints are called arthrology. Now, what is articulation? It is a union, or junction between two or more bones, or rigid parts of the skeleton. Normally, the joints exhibits variety of forms and functions. Some joints have no movements. Some joints allows slight movements. Some are freely movable. Any physical type of joints, or human body joints, have axis. They are uniaxial, biaxial, and multiaxial joints. With this introduction, I will start today's session regarding the classification of joints. Generally, the human body joints are classified into 1. Structural classification, 2. Functional classification, and 3 is biomechanical classification. We will discuss about the structural classification. The structural classification is further divided into 3 subtypes. They are fibrous joint, cartilaginous joint, finally, synovial joint. Now, why joints are called fibrous joint? Bones are connected by fibrous tissues, that is, ligaments or membranes. Most of the fibrous joints are immovable type of joints. In human body, the fibrous joints are further classified into 3 types. Number 1 is suture. The sutures are seen only in skull. Different skull bones are held tightly by fibrous or sutural membrane. No movement occurs in these joints. Number 2 is syndesmosis. Articulating bones are parallel, united by flattened sheet of fibrous membrane or ligament. Slightly movable. Example, interosseous joints of radius ulna and tibia fibula. And third type of fibrous joint is gomphosis or peg and socket joint. This joint is present between tooth and alveolar socket of jaw bones, by fibrous or periodontal ligament. These are micromovable joint. This image shows the different types of fibrous joints, sutures, syndesmosis or interosseous joints, and gomphosis. Till now, we have seen different types of fibrous joints. Now, it is the time to discuss about the second type of structural classification, is cartilaginous joint. Why are these type of joints are called cartilaginous joints? Because the articulating bones are united by hyaline or fibrous cartilage. Partially or temporarily movable type of joints. Further, cartilaginous joints are classified into 1. Primary cartilaginous joints. Here, bones are united by hyaline cartilage. Usually temporary joint, present during the development of long bone. Example for this are epiphyseal plates of long bones, that uniting the epiphysis and diaphysis. Number 2 is secondary cartilaginous joints. Here the bones are united by fibrocartilage. They are strong, but slightly movable. The examples are joint between two vertebrae by intervertebral disc. This illustration shows 2 types of cartilaginous joints. The left one is primary cartilaginous joint, and towards right is secondary cartilaginous joints. Here is pubic symphysis is given as example for secondary. Sinovial joints are the last category in the structural classification of joints. Sinovial joints are the most common, and highly movable type of joints in the human body. These joints are lined by synovial membrane. Contains synovial fluid, rich in polysaccharide materials. Because of hyaluronic acid, the synovial fluid is viscous in nature, thus reduces the friction, and allows free and smooth movement between bones. This synovial fluid nourishes the articular cartilages and articular ends of bones at joint. This animated image showing the general structure of synovial joint. Dear students, see the free flow of synovial fluid in the joint cavity. Now, what are the key features of synovial joint? Number 1. In all the synovial joints, whose articular surfaces are lined by articular cartilage. It is mostly made of hyaline cartilage. Number 2. The synovial cavity, this cavity lined by synovial membrane, that secretes synovial fluid, it provides lubrication, nourishment, and shock absorption to the joint. Number 3 is joint capsule. In all the synovial joints, there is a fibrous capsule, which present outside the synovial membrane. It provides stability to the joint. Now coming to number 4, the ligaments. These are made of dense connective tissue, present outside the joint capsule, sometimes and inside. These are stronger structures, reinforcing the joint, and provide stability. At last, bursa. In plural, bursae, are small pocket-like protrusion of synovial membrane with fluid, that reduce the friction between tendons, ligaments, and bones, near the joint. The synovial joints are further classified into 6 different types, based on their structure and range of motion. They are 1. Plane or arthroidal joint. 2. Hinge joint. 3. Pivot joint. 4. Saddle, or cellar joint. 6. Condylar joint. And finally, 6 is ball and socket joints. This is highly advanced type of joint, at a time, produces different types of movement in combination. What is plane or arthroidal joint? Also called as gliding or sliding joint, movement occurs in single axis or uniaxial, facilitates single movement at a time. Both articular surfaces of the bones are flat or slightly curved, so the bones slide over each other. And the examples are intercarpal joints and acromioclavicular joints. The following are some pictorial examples of the plane, or sliding, or gliding, or arthroidal joints. Next is hinge joint. What is hinge? Dear students, daily we are seeing the hinge, somewhere in the house, or other working places. The hinges are the affixed, small metal plates that allow doors, lids, and other movable parts to rotate or to close and open. It is a flexible joint structure, allows seamless swinging. Like the door hinges, some of the human joints behave like hinges, that is, convex surface of one bone fits into the concave surface of another bone. The hinge joints allows movement in only one plane or uniaxial at a time. Commonest examples are elbow joint, knee joint and ankle joint. Some examples of hinge joints. Next variety is pivot joint. What is pivot? In physics, the pivot refers to a pin or shaft that a mechanical component rotates on. Some of the human joints are classified as pivot joints, and they are also named as trochoid joint. Pivot joint is a uniaxial joint that only allows rotation in one direction. One of the bones in that joint is fixed or stationary, while the other bone can move. This means that the fixed bone works as the joint's axis. Some examples are superior radio-ulnar joint and atlantoaxial joint. Dear students, here I have showed 2 different types of pivot joints. But both are showing that one bone is stationary, and another one is rotatory. The cross mark indicates the stationary bone, and the tick mark indicating the rotatory bone. My dear medicos, the last 3 types of synovial joints we talked about are uniaxial joints, which means that they only move in one direction at a time. Now, I am going to discuss about the biaxial joints. Now, saddle or cellar joint. Why joints are considered as saddle joint? Articular surfaces are reciprocally receptive in nature, that is, the opposing surfaces of joint are reciprocally concavo-convex. At a time, it produces 2 movements, because of biaxial nature. Mostly, flexion with adduction, and extension with abduction can occur in this joints. Example for saddle joints are first carpometacarpal joint, sternoclavicular joint, and incudomalleolar joints. The second type of biaxial joint is condylar or ellipsoidal joint. In condyloid type of joint, an oval-shaped condyle of one bone fits into an elliptical cavity of another bone. Condyloid joints allow movement in two planes that is biaxial nature, which includes flexion, extension, abduction, adduction, and circumduction. These joints do not permit rotation. The examples are wrist joint, metacarpo, and metatarsophalangeal joints, atlanto-occipital and temporomandibular joints. The provided image displays a few number of examples of the condylar joint. Now, the last and advanced variety of synovial joint is ball and socket joint. Ball and socket joint, also called as spheroidal joint, where the spherical head of one bone fits into a rounded socket or cup-like depression of another bone. These are freely movable type of joints when compared to remaining synovial joints. This joint allows for a wide range of movements because of multi-axial nature, which includes flexion, extension, abduction, adduction, medial and lateral rotations, and circumduction. The beautiful examples for this joint are shoulder joint, hip joint and incudostapedial joint of middle ear cavity. This accompanying visual representation depicts the examples of ball and socket joints. Dear students, with this we are completing the structural classification of joints. 2 more classifications are left. So, I am going to discuss with this to you. Please stay back. Let me discuss the functional classification of joints. Functionally, the joints are classified into 1. Synarthrosis, permit little or no movement. Most of the fibrous joints comes under this variety. 2. Amphiarthrosis, permits slight movement, but more than synarthrosis. Examples are cartilaginous joints. And 3 is diarthrosis, permits variety of free movements. All synovial joints are diarthrosis. Final and third variety of joint type is biomechanical joint. In this type, joints are classified into 2. 1. Simple joint, formed by 2 bones, or with 2 articular surfaces, and the examples are shoulder joint, hip joint, etc. Number 2 is compound joint, means formed by more than 2 bones. Examples are wrist joint, knee joint, etc. Here are the examples of simple joints and compound joints. Dear all medical students, here we have completed the entire classification of joints, which includes structural, functional, and biomechanical classifications, also includes their subtypes. Hope you all studied well about the joints. Please you all, spare couple of minutes for the final touch of human joint. That is general movement of the joints. They includes 1. Flexion, 2. Extension, 3. Adduction, 4. Abduction, 5. Medial rotation, 6. Lateral rotation, and 7 is circumduction. For the entire explanation about these joint movements, please see my video regarding general movements in anatomy. The link is given in the description box and here too. Now, the session is completed. Dear students, hope you all enjoyed this session. In the next video, I will discuss about the general anatomy of muscular system. Please like, comment, share, and subscribe. Good day all.